Vestibule and cavitas oris propria, oral cavity. Vestibule. What is the vestibule of the mouth? Space between lips and cheek on external surface, and internally teeth and gum. Teeth and gum. Gingiva. Gum. Gingiva. Vestibule of the mouth opens into environment with the help of rima oris, that is a space between lips, rima oris. And which duct opens into the vestibule, please? Who can answer? What is the name of duct of which salivary gland? Parotid gland. It opens into the vestibule in which place?
Opposite to the upper mole, second mole.
Upper second molar, yes, opposite to the upper second molar. That is place where parotid duct opens into the vestibule. Good. Behind of teeth we have cavitas oris propria, and it has superior wall that is hard and soft palate. Inferior wall, what is it? Diaphragm of the mouth. And which muscle? What is the main? Mylohyoid muscle. Good. Musculus mylohyoidus. You're right. And anteriorly and laterally teeth with the gum. Posteriorly, oral cavity continues into oral part of pharynx through what? Fauces. That is opening between oral cavity and pharynx. Walls of fauces. Superior wall, that is posterior border of soft palate, or it has name velum palatinum. Velum palatinum. Posterior free border of soft palate, velum palatinum, that is superior wall of fauces. Laterally, that is arches. Arcus, palata, glossus. And inferiorly, that is dorsal surface of the tongue. Now, hard palate consists of bony palate together with mucous membrane, and bony palate consists of palatine process of what? Maxilla, and lamina horizontalis of palatine bone. Soft palate consists of two layers of mucous membrane, superiorly mucous membrane and inferiorly mucous membrane. And between these two layers of mucous membrane, we have 5 muscles. What are they? Musculus palato glossus, palato pharyngeus, musculus unpaired muscle uvule, you're right, and musculus tensor belly palatini, and musculus levator belly palatini. Muscles between soft palate and tongue, musculus palatoglossus and musculus palatopharyngeus, together with mucous membrane, makes arches, arcus palatoglossus and arcus palatopharyngeus, and space between these two arches, that is a tonsillar fossa, fossa tonsillaris. And which tonsil it is?
Tonsilla palatine.
Palatine tonsil, tonsilla palatina, yes, palatine tonsil, tonsilla palatina. It is paired tonsil in oral cavity, and unpaired tonsil in oral cavity, that is lingual tonsil, tonsilla lingualis. 3 tonsils we know in oral cavity, 1 paired and 1 unpaired. Another 3 tonsils in nasal part of pharynx. In pharynx we also have 3 tonsils. Unpaired tonsil, that is pharyngeal tonsil, tonsilla pharyngea, and paired tonsil, tonsilla tubaria. That is why total number of tonsils, there are 6. That is lymphoid ring of Pyragov and Waldeyer. Pyragovs and Waldeyer lymphoid ring. What is the function of this lymphoid ring? Function. why we need in lymphoid tonsils. That is protection from infection, immune function, protection from infection in the beginning of respiratory way and in the beginning of digestive tract. Now, somewhat about tongue. Tongue, that is a muscular organ. It supplies with mucous membrane. It consists of muscles, and muscles of the tongue subdivides into three groups. First group, they are muscles of first visceral arch, which start from mandible. What is the muscle which start from mandible?
Genioglossus.
Genioglossus, and continuation of genioglossus muscle is
Vertical muscle.
vertical muscle, musculus verticalis. Yes, it is continuation of musculus genioglossus. Muscles which start from second visceral arch, that is styloglossus,
superior and inferior
longitudinal muscles. And last, third visceral arch. From third visceral arch start musculus hyoglossus and
longitudinal transverse
muscle, musculus transversus lingua, that is continuation of musculus palataglossus. Musculus palataglossus continues into transverse muscle of the tongue. Mucous membrane of tongue has a lot of papilla. Some of them papilla of general sensitivity, tactile, temperature and pain.
taste.
No, that is general sensitivity, and they are smallest papilla of the tongue. What are they? Smallest? Filiform and filiform and conical, conica, papilla conica, conical shape, conica, and papilla filiformis. They are smallest papilla, and they are papilla of general sensitivity. That is touch, temperature, and pain. All another papilla, they are papilla of taste. They are fungiform papilla, papilla fungiformis, papilla foliata, and papilla valata. Valate, foliate, and fungiform. They are taste papilla, and we can see this papilla on the tongue. We try to do it in a minute. Next, teeth. Some words about classification. All teeth subdivide into permanent and temporary. Temporary or milk dens. They appear in childhood, in newborns at the age of 5-6 months, and near of second year of the life, all milk dens should be present, and milk dens start to change into permanent dens at the age of 6 years. Yes, at the age of 6 years. How many? What is the total number of milk dens? 20, and permanent 32. What is the formula of milk dens? 2, 1, 0, 2. 2, 1, 0, 2. That is in one half of upper or lower jaw. 2, that is 2 incisors. 1 canine dens. The absence, there is no premolars, and 2 molars. 5 dens, 5 teeth in one half of the mandible, and the same 5 in opposite half, that is 10 in lower mandible, and the same 10 teeth in upper row, in upper, in maxilla. 5 and 5 in both maxilla, that is total number is 20. That is milk or deciduous dens. Permanent dens, another formula, 2,
1, 2, 3. 2 incisors, 1 canine, 2 premolars, and 3 molars. Each tooth consists of crown of the tooth, it is upper part of the tooth, then neck, column, dentist, and root of the tooth, radix dentist. All teeth differ one from another with a shape of crown and with a number of roots. For example, what is the name of this tooth? Incisor. It has sharp upper border and one root, that is incisor. Conical shape, it is not so. There is no good canine. There should be conical shape of crown of the canine dents and also one root in canine dents. Premolars has 2 tubercles, anterior and posterior tubercle, and usually one root, sometimes bifurcated root, 2 roots in premolars. But in most cases, only one root in premolars, sometimes bifurcated root in premolars. And molars always has 2, sometimes 3 roots and 4 tubercles of the crown. 4 tubercles, 2 or 3 roots in molars. Main tissue of tooth, that is dentinum, crown of the tooth supplies with enamellum, and root supplies with cementum. Inside of crown we have cavitas dentis. It continues into the canal, canalis, radicis dentis, and opens with the help of foramen apicis dentis. And inside of this cavitas and canal we have pulp of the tooth. This pulp consists of connective tissue, blood vessels, and nerves. Do you know what is a tooth as an organ? What is it? Tooth as an organ. It is not only tooth, but what else except tooth? Alveolar dentalis. And what is the name of connective tissue between tooth and alveolar dentalis? That is type of articulation. You're right, type of articulation. That is gymphosis. And name of connective tissue, that is periodontium. That is why tooth, periodontium, alveolar dentalis, gingiva, vessels and nerves which supplies tooth, all of these organs together forms tooth as an organ. Well, mucous membrane in inferior wall of oral cavity makes fold, sublingual fold, plica sublingualis. Inside of this fold we have sublingual gland, and behind of mandible and below of it we have submandibular gland. And these 2 glands opens on the apex of plica sublingualis with the help of caruncula sublingualis. Well, next, pharynx. Pharynx consists of 3 parts: nasal part, it has so name because it has communication with nasal cavity. And what is the name of opening between nasal cavity and nasal part of pharynx? What is it?
Isthmus.
Listen to me. Pharynx consists of three parts: nasal part of pharynx, oral part of pharynx, and laryngeal part of pharynx. Between nasal part of pharynx and nasal cavity, what is the name of opening?
Thyroid. Epiglottis.
Come here,
Epiglottis.
come here, come here. That is external nose, here it is nasal cavity, here it is concha nasalis superior, concha nasalis media, concha nasalis inferior. They are in nasal cavity today, not so interesting. Now, behind of nasal cavity, we have nasal part of pharynx, that is nasal part of pharynx, here it is oral part of pharynx, and then laryngeal part of pharynx. Here it is pharynx. And now my question, what is the name of opening between nasal part of pharynx and nasal cavity? What is this opening? Hoana, of course. That is Hoana, that is opening between nasal cavity and nasal part of pharynx. Now, oral part of pharynx, it communicates with oral cavity through phalanges. We already said today, here it is phalanges. And in front of laryngeal part of pharynx, we have larynx. Sorry, that is, here it is larynx, that is that is larynx, and behind of larynx, laryngeal part of pharynx. Now, topography. Nasal part of pharynx start from the base of the skull. Here it is skull. Who remember which bone of the skull has pharyngeal tubercle? Who remember?
Occipit.
Yes, pars basilaris of occipital bone has pharyngeal tubercle, tuberculum pharyngeum. That is beginning of pharynx at the base of the skull. Then nasal part of pharynx, it's opposite of the first and second cervical vertebrae. Here it is atlas and axis. These two cervical vertebrae, first and second, in projection of nasal part of pharynx. Then oral part of pharynx is opposite to the third cervical vertebra. And laryngeal part of pharynx is in front from fourth, fifth, and sixth cervical vertebra. And at the level of sixth, sometime at the level of seventh cervical vertebra, pharynx continues into esophagus. Clear it is? Now, here it is, that is musculus uvule. Here it is musculus uvule. This fold is arcus palatopharyngeus. Should be here arcus palatoglossus. Here it is arcus palatoglossus, this one. Here it is arcus palatopharyngeus. Space between them fossa tonsillaris, and this lymphoid tissue, that is palatine tonsil. Now, look here. That is tongue. Here it is tongue. You can see that posterior third of the tongue is different color of posterior third, differ from all another tongue, because here it is lingual tonsil, tonsilla lingualis. Here it is lymphoid tissue, that is lingual tonsil. All another mucous membrane has a lot of papilla. Papilla filiformis and conica impossible to see, only under the microscope you can see papilla filiformis. All another papilla, These small papillae in whole surface of the tongue, they are fungiform. Laterally, these like pages in book. Look here. Is it clear? That is laterally like pages in book. That is papilla foliata. And largest papilla, look here. These papilla, here it is. They are papilla volata, valate papilla. Like letter V, V shape. Here it is. That is papilla volata on the border between anterior two thirds and posterior third. That is papilla volata, only here. They are largest papilla. They are papilla of taste. Who know what is the name of this fold between tongue and epiglottis? Plica,
Median.
glossa, epiglottica, mediana. Here it is. Then lateral here and here, plica, glossa, epiglottica lateralis, and spaces between them here and here, they are vallecula, epiglottica, vallecula, epiglottica. That is all what we can see in preparate. Sagittal section of the head, here it is pharynx. Just a moment. In nasal part of pharynx, here it is, we can see opening. What is this opening? That is auditive tube, tube auditiva, or Eustachian tube. Tube auditiva, auditive tube, that is communication between pharynx and middle ear, tympanic cavity. Why we need in this tube? Because necessary to equalize pressure, atmospheric pressure and pressure in middle ear. And that is very important function. And auditive tube has cartilage, that is cartilaginous part of auditive tube. And cartilage of auditive tube together with mucous membrane makes eminence on the surface of pharynx. That is torus tubarius. Here it is torus tubarius. This torus consists of cartilage of auditive tube together with mucous membrane. Between auditive tube and soft palate, in this place, we have tonsil, tonsilla tubaria. And on the border between superior wall and posterior wall of pharynx, in this place, last unpaired tonsil, that is pharyngeal tonsil, or tonsilla adenoides, tonsilla adenoide, or pharyngeal tonsil. That is on the border between superior and posterior wall. Sometimes in children, this tonsil is very large, and it's closed auditive tube. It closed nasal part of pharynx. That is why some problems with breathing. In this case, children will breathe in through mouth. It is not good because air should pass through nasal cavity. It will warmer, moisten, and that is physiologically more better to breathe in through nose, not through mouth. That is why in this case necessary to remove this tonsil. But in normal, at the age of 11, 12 years, this tonsil decrease in size, and it will not a problem after 12 years. After 12, it is not a problem, adenoids. But before, at the age of 6, 7, 8, sometimes necessary to remove adenoids if they closed pharyngeal tonsil or if it closed nasal part of pharynx. Well, that is all what we can see in preparate. Take your places.